18 minutes past 8. Let's continue the conversation because France obviously is something that people are going to be talking about. The Netherlands as well added to the list. If that happens, does that mean that it will help curb the spread of the virus here? We can talk to Sir David King, who's the former Chief Scientific Advisor under Tony Blair and Gordon Brown. Thank you very much to David King for joining us. I just want to kind of put your position into context. You chair an independent alternative to SAGE, don't you?
We set up independent SAGE as an alternative means of providing advice into government and into the public domain. All of our work is done in the public domain.
Okay, so have you had any consultation with the government in terms of the run-up to this decision?
No, we haven't. Let me say the decision on France is a decision on a strategy, and I don't think we're going to question that decision. What I think I'm much more concerned about is the sudden removal of 1.3 million COVID tests on the 12th of August, very quietly. And this is just one thing that has been happening from the beginning. We are very concerned that we don't know what the strategy of the government is, if there is a strategy. So, for example, on the 31st of July, the Prime Minister announced, and we fully agreed with that the reopening of schools in September was the government's absolute priority. We had made that very clear a few weeks before. But the follow-up to that is, as we said, the month of August is our summer month when we can deal with the level of infectivity in this country, bring it down so that when we reopen schools, we don't see another big increase in the disease in the country. Now, regrettably, this has not happened. The announcement on the 31st of July was not to reopen some of the measures that were previously meant to begin on the 1st of August. But now we know that tomorrow those measures will be introduced. So indoor theatres, spectators at sporting events, and so on, casinos reopening. So I think what we are concerned about is that any advantage that has been obtained by levelling off the amount of disease in the country is being lost by reopening this before we reopen the schools.
Can I ask, sorry for interrupting, Chris Whitty a couple of weeks ago said that we are at the limit of what we can do in terms of reopening as a society. So with lockdown measures easing in England, we've been talking about that today, then you contrast it with the restrictions and quarantine restrictions and measures put into place from anyone returning from an extended list of countries from 4 a.m. on Saturday. What do you see in terms of the limits of the spread of coronavirus? Have we reached them, or should we now just expect the levels to rise?
We should now expect the level to rise given the strategy that seems to be followed by the government. But let me just very quickly say, we fully understand the need to recover our economy. We fully understand why the government is anxious to reopen all of these things. But at the same time, if we reopen too soon, we lose the opportunity because we'll just put everything back into lockdown as it takes off again. The best thing for our economy, the best thing for the health of the nation is to put ourselves back into some measures of lockdown so that we can bring the level of disease in the country down, and I would say bring it down by a factor of 10 or so towards what we've called zero COVID. If we reach that level, when we reopen schools, we can be more confident that we won't be putting them back into lockdown. So I think we fully understand we want to reopen the economy quickly, but while we also have a test and trace system that is failing, I just said 1.3 million COVID tests have been dropped from the data, while we understand that 750,000 unused coronavirus testing kits manufactured by Randox were recalled for reasons of safety. When we have all of these failures of the test and trace system, but most importantly, it's not the number of people you test per day, it's what you do with the results of the test. The whole point is that anyone who has the virus has to be put into isolation, not just asked to go into isolation, but check that they are in isolation and capable of being in isolation. In many homes, there are multi-generational families living together. It would not be very clever to put somebody into isolation in such a home, putting the older people at risk. So what we would say is the government needs to do what many other countries in Europe have done, which is to requisition hotels and see that people who cannot manage self-isolation are actually put into those hotels and looked after, supported, as in terms of food and medical supplies and so on.
So David King, I'm sorry to interrupt, time is against us, as you know, the problems with live television. Thank you so much for your expertise this morning. So David King there, former government scientific advisor and now chairing the independent alternative to the SAGE committee.